Back bends. There is opinion that we don't have a much back bends on the sequence, but actually every vinyasa, when we do upward facing dog, this is the back bend. So, and altogether it will be 108 back bends through the vinyasas only. So this is pretty a lot. But that deep kind of back bends, we have just on the beginning of the finishing sequence, and traditionally it will be 3 rounds. Every round will be for the 5 breaths. In the same time, I want to draw your attention that this is traditional approach. Yeah, traditional, as we know, this is effective and safe, but through your personal experience, you can make that researching. So if you will do 3 times, each one 5 breaths, this is difficult to do if you do it on the deep way, but especially on beginning. If you will do 6 rounds, each one 5 breaths, this is easy. Because through the practicing, you will stimulate activation of the sympathetic nerve system. So your floating ribs physically, mechanically will affect to your adrenal glands. You know adrenal glands? We have a kidney. On the kidney we have a gland that kind of, you know, cortisol, adrenaline, noradrenaline comes from there, so you have a lot of power. That's why normally after workshops of the back bend, people feel a lot of power. So this is the chemical reaction like that inside of the body. So. And what we will do now? Now we will start with the most of simple, most of gentle way how we will practice, how we will work with the beginners. And all this, it will start with the, Sonia, come here, with the power of the muscles. First, power of the muscles, then flexibility. Normally, women's, they have an open spinal muscle, spinal joints, yeah, and they can do back bends easy, but they don't have enough power to do. We will start from beginning. Modification of beginning will look in next. So hips all the way up, interlock your hands, straight your elbows, and stay like that. Important thing which you have to draw attention of your students from beginning. Heels, all this will be on the floor. Don't let your students to bring heels up. Why? They will bring heels up, low back muscles will relax. Relaxed low back muscles, injury, this is a question of time. Heels, all this on the floor, and better to help them to remember these things from beginning, like that. This is modification. But this is the final beginning modification, how it should looking like. Let's see how it looking like from with the people never practice. Угол вниз. That means you can see the angle goes down. From this position, still try to lock your hands, still try to straighten your arms, it will be difficult now. I will pull your hips area, pelvis area up. From sumo position, we'll grab it and pull it up to help her create that angle higher. When she passing through the line, straight line, and angle goes up, what I will start to do? I will force producing of synovial liquid in the joints of the low back area. How? I will drop my body weight there. How it looking like? Triam. And now I will sit down to her knees. Now my body weight through the knees, through the heel goes to the floor. This is not difficult to hold my body weight like this. But now I will put my palms to the pelvis joints, pelvic bones, like that. So a little bit body weight here, and this is not that easy now. Now, more not easy. Now I will request to control the balance. Balance. Keep us together. Now body weight forward. More body weight. More, more. And now I can stay even like that. All my body weight there. You understand? Very good for the joints, intervertebral joints, to produce good quantity of synovial liquid. It will create particular pressure into each joint. Joints will be healthy. Enough food, enough lubrication, yeah, and then we can go forward. What does it mean, go forward? Sometimes this element with your body weight there will be useful even for advanced people. What does it mean, advanced people? Come up again, the same. And now I will put towel here. This is a challenge for you. This is a challenge for the student. Because sometimes students, teachers, they have no time to the self-practice. And this is very not stable foundation. And of course, students have to control your balance. And you also need to find that rhythm, or how to say, of the movements. Еще раз попробуем без полотенца. Сможешь? Don't let me fail. Don't let me fail. Don't let me fail. Breathe. So this is not easy for me. This is not easy to her. And as I told you, it will be a challenge for the advanced practitioners also. You have to control half. Students have to control half. If someone not confident, face goes to the face, you on the log, tears, student gone, you have a hematomes, and student will not come back. So you have to be confident, yeah? That means you have to practice this element by yourself without student. I mean, you just super easy for you. Then you can start to do with a not stable foundation. Okay. Student have a, ready? Students have enough power on the spine. Synovial liquid enrich mobility of the joints, intervertebral joints, and the muscles strong. Now, I will show you from the two sides. Now we will start to work with the upper part of the spine. Actually, we work with the shoulder joints and with the muscles of the spine and the arms. So to come up, you need to push your body up. How we will do? Palms to my ankles. Palms to my ankles. Feet on the hips wide, parallel to each other. Next, hips up, hips up. Elbows in, shoulder blades. Push. Come up, come up, come up, come up, come up, come up, and we stand like that. Even can do like this. 1, 2, 3, 4, 5. So we work with the shoulders and we work with the muscles, but wrist joints out of the dangers. So this angle, we're not forced. Head up and exhale down. Very good. My feet in front of her shoulder joints, hips up, elbows in, shoulder blades, push. And I'm support her. 1, 2, 3, 4, 5. Inhale, head up, and exhale all the way down. Okay. There is another method, but to provide it, you need to have a kind of equipment. Equipment like this. Very easy to do. Very easy to do. And very, how to say, useful for the students on beginning way to protect from the wrist joints injury. How it will looking like? You can use this one, or you can use just the blocks. If you have equipment like that, you can use equipment like that. If no, 2 blocks also will be useful. So what I want student to do, head on the middle of the wood. Come higher, 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 higher. Palms to the wood. This angle will protect the wrist joint from the injury. This wood or block like this, it also less stable, but still can be used. Now, hips up, and I will little bit help here. Push, 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 push. And here student can try to straighten the knees. He will be surprised. He can straighten arms and the knees also, because wrist joints will limit it, will factor of the limitation on that moment. Then head up and exhale down. So 3 times, 6 times, more times, muscles stronger, joints more flexible. Or дай ко мне. Or with the blocks. Давай. Palms to the blocks. Hips up, and I just help her to stand like that. 1, 2, 3, 4, 5, then head up, and exhale down, like this. Understand? Okay. Lower back done, upper spine, I mean shoulder joints and activity of the muscles, okay. Now we start to work with the wrist joints. Here we have a I don't know if it calls adjustment or just support, but still there is the element which will be very, very useful. How it's looking like? Alignment, feet on the hips wide, closer. Sometimes also will be effective to provide a block for the students and request to keep during all practice like that. Next, palms to the floor. Prepare yourself. My part, I will put my foot to her fingers, even a little bit to the palm, but there is no body weight there, just touching. In case arms will jump in forward, I will not let it, I will control. Hip up, another foot under her bottom. Then I will grab her shoulder blades and pull it up. Then I will sit down under her bottom. Lock, 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 lock. And here we stand for 5 breaths, but not stand, we move. 1, 2, 3, 4, and 5. Next, head up and exhale slightly down. This position gives you total control of the body. All what you need to do, just request from the student to follow your instructions. So foot to the palm, foot under bottom, hip up, yeah. Shoulder blades, push, sit down, around, under this bottom. This is lock, palm, palm. This elbow on my leg. And we stand here, 1, 2, 3, 4, 5. In case something happened, I can control like that. You see? Her body weight on my foot, Head up, down. Just follow my instructions, that's it. Bend your knees. More, yeah, palms prepare. So, never push. Just here, in case arms will jump like that, I will not let it, I will lock it. So, then hip up, this one up. So, shoulder blades, slowly push up, inhale, lock, 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 lock. And we stand here, 1, 2, 3, 4, 5. And even you I can control, yeah, you see? Head up and exhale down. You see? One foot to the palm, another foot under her bottom. Hips up, shoulders, all the way, shoulder blades, all the way up. Sit down, reach around, under her bottom. Lock this palm to one shoulder blade, another palm to another shoulder blade. and like this we stand. So her body weight to this knee and to this knee. This is a lock, yeah? Then head up and exhale down. Next. Some students have a very flexible low back, but have problems with the upper spine. This is not working as it should be. Then what we will do? Come here, Sonia. Middle spine on the top of the ball. Middle spine on the top of the ball. Grab upper one. Now bend your arms up. Okay, feet closer, feet closer. What I will do? First, lock the ball, shoulders, push up, push up, push, 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 push. Here stand for 3 breaths. 1, 2, 3, 4. 1, 2, 3. Exhale down. Down. Step down. Inhale up. 1, 2, 3, 4, 5. Now palm under her spine. Exhale down. Inhale up. Step down. Inhale up. Up. 1, 2, 3. Exhale down. Step down. Inhale up. 1, 2, 3. Exhale down. Inhale up. Step up. Inhale up. 1, 2, 3, 4, 5. Exhale. Step up. Come up. 1, 2, 3, 4, 5. Exhale. Come up. Inhale. 1, 2, 3, 4, 5. And down. Now, sit down to your bottom. Sit down to your bottom. Sit down. No, keep it, keep it. Upper one, upper one. Sit down. Straight your legs. And now we work with the mobility of the shoulders. Little bit here, little bit here. No space between low back. Request. No space here. And we work. Stretch this side, stretch that side. This one, these muscles, this is a self-practice. Student looking for, tense in this position, muscles stretched very, very good. So necessary to stay in here a little bit longer. Then cross your arms on the chest and release. They request to bring knees, we request to bring knees together. Finally, it will affect the hip joints. Hip joints. Position of the hip joints will affect to the angle of the pelvis in general. This is connector between spinal column and low part. So angle of the hip of the pelvis will affect to condition of the spinal column, which will affect to the everything. So better to keep knees closer. No, it not goes that way, but goes here. And don't forget, next level of the back bends, actually we can say final level. This is drop backs. When student goes down by himself and when he come up by himself. Din, din. You understand? And here, particular muscles working also. You understand? If you will do like that, many people do like this. Yeah? But then they will feel something strange on the spine. Or they will keep right configuration, safe configuration. So important, position of the knees, important. There is a method how to practice drop backs by yourself. Beginning of drop backs. Come here, come here. Yeah, like that. Feet on the hips wide, Namaste Mudra, and you need to kind of like a rope закреплена, fixed on your chest area. Yeah, and every inhale it will pull your chest up. Every exhale, you send your hips forward. Inhale up, hips forward, exhale. Inhale, exhale, inhale, exhale, inhale, exhale. This is the right entrance to the drop backs. Then drop your head back. You see the wall, touch the wall, and come back, and inhale, come up. exhale down, inhale up. This is useful. Finally, you can put your palms to the wall. Go, inhale, exhale, inhale, exhale, inhale, exhale. Palms to the wall now. Touch. Very, very slowly by the small steps, go down, 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 down. Then inhale all the way, touch the wall by the chest for 5 breaths, then palms to the wall, and come up, come up, come up, come up, come up, and all the way up. So this is also, here we work with the muscles, here we work with the flexibility and mobility of the joints. Here when you go down and you go up by yourself. And final part of the back bends, which you can provide to the students, this is drop backs. We can provide drop backs for the students. They pass through all levels. They don't feel pain on the feet, ankles, hips, spine, neck, shoulders, elbows, wrists. So they don't feel pain. Then you can provide this element like a drop backs. Actually, there is the method how you can provide drop backs for advanced practitioners. Wanted to draw your attention again for the point that some people, some advanced practitioners, they think they're flexible, but they just have not enough collagen. This is the fact. And fact don't care about their opinion. This is the fact. There is the disease. It calls spondylolisthesis, slippery discs. Slippery discs, not strong enough collagen. Collagens, this is the 80% of the connection tissues. 20% this is flexibility, elastin. So not enough collagens. Elbow goes to the minus, knee goes to the minus, yeah? And of course it will looking like a flexible, but they're not flexible. So even for this, and these people, they're scared to do drop backs because this is not a comfortable life with the pain. This is even not life. You cannot concentrate, you cannot walk, cannot eat, cannot sit, cannot talk, cannot nothing, because this is pain non-stop. And they scared. They still want to practice, but they don't do drop backs. 100% of the people like that who come in here, we provide them very specific drop backs, and they see the difference between, so they see like they can do it, still can do it, but with the particular conditions. Let's see with the normal first, normal. We'll show you from the two sides, from here and then from there. So, what you will do? First, Namaste Mudra. Namaste Mudra. To the body, elbows to the body. Relax yourself. Your foot goes inside. There is the space between us. If I will stay too close, when she will goes down, her body will move forward and she will hang on my hip. Legs will come in and up, so no. I need to keep the distance, and with her movement forward, I need to move my hips back also. There is the algorithm, how it looking like. Foot inside, I will sit low, low. Next, position on her spine, upper spine. This is the position for beginners, looking like that. Middle spine, this is the for intermediate, experienced practitioners, looking like that. And low back, this is the for advanced practitioners. So upper spine, middle spine, low back. So let's start to do like with the middle. I will go low, palms to the middle spine, and I will use my shoulder to show her. I'm ready. Inhale. Inhale. I go together with her for the halfway. Then I straighten my arms, touch, bend my arms, and together come back. Understand? Like this we will do 3 times. Second time. Inhale. Together, arms straight, bend my arms, and come up. Important thing, students have to train to keep movement of the arms. Arms goes like this and come back the same. If student do like this and like that, this is not right. Arms goes up and come back from the up. And last time, inhale, inhale, together, arms, arms and together. This is first part of the drop backs. Second part of drop backs. I will ask her to cross the arms on the chest area. If she don't have hyperkiphos of the chest area, if her shoulders don't go that way. In case it goes that way, I will request Namaste Mudra behind the spine. It will open her chest better than anything. But we'll start with a simple one, cross your arms. This is traditional. Algorithm of my movements will be the same. I will sit low, inhale, halfway together, then straight my arms, touch, then bend my arms, and together come up. Let's see how it's looking like with the Namaste Mudra. Namaste, namaste. Now, chest open, keep it like that. Then, inhale, inhale, exhale, touch, inhale, come up. On this one, I here, just in case, this is the control, this is the lock. My low arms, even elbows control her body, not the fingers. Okay, you okay? Okay. Third part, this is the halfway. Cross your arms. Now, algorithm of my movements will be changed. How it will change? I will push to her body, push. We work with the power of the legs, halfway. From here, my arms goes to this position, to this. Inhale. Exhale, knees forward. Inhale, come up. Exhale, knees forward, come up. So, yeah, you feel muscles work a lot. Without it, body cannot come without assistance. And third time also. So I push to her body. I use my body weight to force the process, to force power of her muscles. And last part of this one, Namaste Mudra. We will go together, the same. My activity will be the same, but we'll stand there for 5 breaths. So. Inhale. Halfway together, straight my arms, control. 1, I pull her to my side and counting. 2, 3, 4, attention. 5. Little bit low, to the bottom if there is the trust between you and student. Under, here. Yeah, student have to do some part by himself, by herself, like that. And after that, of course, necessary to provide counter pose. If you provide drawbacks, counter pose also. But first, we will do everything. Namaste Mudra. First part, inhale. Exhale, touch, inhale. 3 times. Second part. Head to the floor, inhale, forehead to the floor, exhale, touch and come up. Third part, halfway, inhale, exhale, bend your knees forward, inhale, come up. Okay, 3 times. And last one, Namaste Mudra, inhale, halfway, straight my arms, and we stand 1, 2, 3, 4, 5, and I will move her body up on the 5th count. So that's what we were talking about, how we can work with the people with the slippery discs. Normally, we need to take off tension from her low back. Don't let her low back to go to the hyper bending. So we need to protect low back area. How we can do it? I will compensate the pressure by my arms. Namaste Mudra. Foot inside. Now, elbows. I'm sit low. Elbows here. Palms like this to the shoulder blades. When we will go down, my movement will go like this. Like that actually, but not that much, like this. I will stretch this part, and don't let it goes to the deep bending. Inhale, exhale, touch and inhale, and arms come back to this position. So this movement and come back. After that, I will provide kind of compensation. Compensation already was sorted, like a kind of, it can be like a forward bend on the Padangusthasana and Padahastasana. It can be like this. You remember this adjustment, yeah? Or tie here. Namaste Mudra. Inhale, exhale. Understand? Some compensation to her lower back. Or with a towel, sit down. One tip of the towel here, another like this, by diagonal. My shin on the another tip. Inhale, inhale, and exhale my body weight. Inhale, exhale. Inhale. And now I go to the levels. Just little bit recover blood circulation, recover circulation of the other fluids around the spinal column. Платоха, тихо, сынок. Тихо, зайка. Animation for the drop backs. Foot inside. Then palms to the upper, middle, or low back. Let's do with the middle spine. Arms sit low, and we go together, straight, bend, come up. My knee bended, not straighted, bended. And another also, like this, I am more confident, more stable than with this. Another thing, some people, actually all of us, have one part of the body, one side of the body, stronger than other. For example, if you write by the right hand, your right part will be stronger than the left one. And then, when you will go to the drop back, one leg will push a little bit more. And you have a chance to fall down together with the student. Because he moves to the side, not back. You ready for the back, he going back. But he goes to the side. Yeah? So what you do? You will put your foot like this. Here you cannot bend your leg down, but it still can be bended. And like this, you can more balance. And the same. Exhale, inhale. Understand? Next one. All the way, head to the floor. Then palms to these bones. Exhale, knees forward. Exhale. Exhale, 3 times. Then, with the Namaste Mudra, halfway, straight arms, palm to the hips. Forward 1, forward 2, forward 3, 4, 5. And then compensation. Tin, tin, tin. Yeah? Got it? Okay. You practice drop backs? Never. Let's try. Sit, foot inside, space, sit low, palms here. Inhale, halfway with you. Exhale, and then straight my arms, you touch. Then bend my arms, and together come back. Very good back bend, drop backs. Let's go to the second one. Forehead to the floor. Inhale, exhale. Algorithm the same. Touch and come up.
I noticed I am lifting my heels.
Yeah, this is bad. Don't lift it.
I just noticed.
Because your low back can be injured. Let's try to do, use my support, I'm here. Don't bring it up. Resist to me. Cross. Exhale. Slowly, slowly, slowly. Don't hurry. Touch and come up. Don't come up like this. Come up like that.
Okay.
You understand? Okay. One time. 3 times, halfway. Cross. Hips forward, bend your knees, bend, drop your head, and come up. Hey, one more time. Yeah, like muscles work.
Wow, this is very
Interested. Yeah. And the last one, last element. Last element, I will show you how we work with the spondylolisthesis. Yeah, come close a little bit. Elbows here, palms here. Inhale, exhale. You feel stretching?
Yes.
So they can go all the way down, and then inhale all the way up, and then my arms also change. Okay, and compensation. Inhale, exhale. Inhale, head up, exhale, jump back. Okay.